Now, for up next, the next issue we'll be looking at as related to acute rheumatic fever is another major criteria. So, in acute rheumatic fever, we said the patient is having subcutaneous nodules, the patient is having erythema marginatum, the patient is having Sydenham chorea, the patient is having carditis, the patient is having what? Migratory polyarthritis. So for this migratory polyarthritis, we now want to give evidence for it. Do you understand? So migratory polyarthritis, when this is also this migratory, is simply like this. Today the patient is having issues with the joint. Another day they are having issues with his joint. Another day they are having issues with joints of the fingers. So that's why we say it's migratory. It's moving from one place to another. Okay. So it's actually one of the major criteria for picking up acute rheumatic fever. Okay, so there's migratory inflammation of large joints. It's mostly large joints, knee, ankles, elbows, wrists. Okay, so what's the migratory pattern? Like I told you guys, today is this joint, another day is this joint. Okay, so it's moving from one joint to another, so it can even resolve totally in one joint and appear in another one. So large joints are affected, usually the knees, the ankles, the elbows, the wrists. So you have other associated issues like redness, swelling, warmth to tell you that there's what? Inflammation there, and the person is not able to use the joint like they are using it before. Okay, so there's limited movement. They're non-deforming, so it does not cause permanent joint damage. Okay, so and another thing that you can basically use to confirm that is once you give non-steroidal anti-inflammatory drugs, the condition resolves immediately. Do you understand? So polyarthritis is basically a major criteria. So pathophysiology is immune complex deposition. So antibodies formed against the group A streptococcus are the ones that are cross-reacting with the synovial tissue. Okay, leading to what? Inflammation in the joint. Okay, so that's why. So to solve that, they mostly use aspirin, corticosteroids like prednisone or prednisolone, okay, and all of that. And the person has to rest. You can't be stressing that joint that is affected by this.